Here are 5 questions and answers about ketamine addiction. Number 1, what is ketamine? Ketamine is something that's used in medical facilities and hospitals. It's really what it is. It's an anesthesia when it's being used correctly, and it's being used to put people in a trance-like state and provide pain relief while they undergo procedures. Ketamine is also used recreationally. People like to use ketamine because it's a dissociative. It helps them disconnect from reality. It helps them get away from whatever in their world is going on. They want to get an escape. They use ketamine. Is ketamine addictive? Yeah, absolutely. If you use ketamine enough and if you use it more frequently, you can definitely get addicted to it. It does have potential for you to become dependent on it and for your body to begin to crave it. And the more often that you use it, the more your chances are of getting addicted to ketamine. What are the signs of ketamine addiction? Well, one of the big signs that we always like to talk about is cravings. Can people experience cravings for ketamine? Yes, absolutely. And the higher your cravings are, the more you're going to want to do or be willing to do to get that next hit or get that next ketamine high. What people do to get high or what people are willing to do, the lengths they're willing to go to get this substance all depend on how high those cravings are. If you're not having a high craving, then you say, what, if I get some, I get some. If I don't, I don't. When you're experiencing super high cravings, people will steal for ketamine. People will abandon their relationships for ketamine. People will turn on their loved ones to get some more ketamine, depending on the severity of your cravings. And we always base it off of the scale of 1 to 10, 1 being the lowest and 10 being the highest. But there's definitely an ability to get cravings for ketamine even at the highest level. So if you've been using ketamine and you start to get more dependent on it, you're going to start to experience some withdrawal symptoms. Some withdrawal symptoms include confusion, agitation, psychosis. With psychosis comes 2 categories: auditory and visual hallucinations. Auditory hallucinations is when you start to feel like you're hearing things. Maybe you feel like you heard somebody call your name, you turn around and nobody's there. That's an example of an auditory hallucination. Visual hallucinations. Maybe you thought you saw something. Maybe you thought you saw a person in the distance and you wanted all your friends to see that same person. You say, hey, who is that over there? Nobody else sees it. Chances are you're struggling and you're dealing with a visual hallucination. Other withdrawal symptoms include loss of motor skills. You can't do your normal daily functions, the things that you usually do as a functioning human being, a functional adult, a functioning young person. You're not able to do that. Nausea is another one. If you're struggling with any of these and you feel any of these symptoms, chances are you're dealing with an addiction. A lot of people don't know that they're addicted, and they really are. A lot of people say, I'm not addicted, I just don't want to stop. That's another way of saying you're probably addicted. I'm not addicted, I just don't like how I am when I don't have it. You're probably addicted. I'm not addicted, I just don't want to hang out with anybody today. I just want to get high and use this drug. That means you're probably addicted. If you're losing relationships, you're turning on your family. Sometimes when you're struggling with addiction, you could say, man, everybody's been tripping on me lately. People are not acting how they usually act. I don't know why everyone's so upset with me. If everybody in your world is feeling the same way about you, chances are you're the one that has to fix a problem. You're the one that has to change. And there's a lot of options for ketamine addiction. Don't feel hopeless. Don't feel like you're alone. Don't feel like there's no help. There's a few options I'm going to talk about with you. Can ketamine addiction be treated? Yes, absolutely. There's a lot of ways to treat ketamine. And what is treatment really? Treatment is figuring out, number 1, how to manage the withdrawal symptoms. Because when you go through withdrawal symptoms, that's one of the main reasons people want to keep getting high. They don't want to feel the withdrawal symptoms. So when you get ketamine treatment, you'll see a doctor. The doctor will even be able to prescribe you a medication to try to get those cravings down. And while you're getting those cravings down, you're working with a team of people who are helping you dive deeper into why do you want to escape? What in your life is making you feel like you can't deal with it sober? What are you trying to hide from? What are you trying to escape from? These are all big reasons why treatment is so important for people. You can get rid of the substance, but when you still have those problems, you're going to just try to replace that substance for this one and this substance for that one. So it's important to deal with what's called underlying issues. Underlying issues could be trauma, it could be anxiety, it could be depression, it could be feelings of loneliness, suicidal thoughts, feelings of hopelessness. All these different things are issues that people want to run from. They don't want to experience those painful thoughts. They don't want to experience those painful memories. So we run to substances, and I've been a part of that too. I've ran from all kinds of situations with substances. And what I realized is you could only run for that certain amount of time when you're high. When you get sober, the problems are still going to be there. And when you continue on that path for a long time, the problems get worse and worse. So it's important that you get the help that you need. You're not alone. There's different options. You could do inpatient or outpatient. There's even options for telehealth. If you can't leave your house or if you got a busy schedule, we've even seen some people that couldn't get help anywhere. They couldn't get help because they were a single mom and they had kids and they had a job. But there's no excuse to not get help. There's no cookie cutter way of getting treatment or getting help. We can help you find some solutions where you could still go to work. You could still have an education. You could still, be a parent to your kids and get the help you need. Some people have the ability to not go to work for a couple weeks and get the inpatient treatment that they need and then get reintegrated back into whatever their normal daily routine was. But whatever your situation, maybe you know somebody who's struggling with ketamine and you want them to get help, share this video with them. Reach out to me at the link in my bio. Comment if you need to hear more about this topic, and we'll be sure to get you whatever it is that you need. Thank you so much for joining in, and we'll see you on the next session.